Hi, my name is Andrea. I'm a nurse practitioner. Can you tell me your name and date of birth, please?
Nicole Stark, 7/7/2003.
Do you know where you are?
Yes, I'm in the hospital.
Okay, great. Can I do a head and neck and respiratory assessment on you?
Yeah, of course.
Thank you so much. So when I look at you, your general appearance, it's normal. You don't appear to be in any distress or fatigue. You look well nourished. When I look at your head, it's normal cephalic. The contour is symmetrical. Can I palpate your head? Do you have any tenderness?
No.
Great. I don't feel any masses upon palpation when I look in the scalp. I don't see any hair thinning, no lacerations, no lesions, no baldness. When I palpate your temporal arteries, it's +2 bilaterally. When I look at your face, there's no facial drooping, there's no ptosis. The eyebrows and eyelash hair are well distributed without any crusting. Now, I don't see any lacerations or scars on your face or any edema. Now, I'm going to look at your eyes. When I look at them, there's no protruding noted. I'm going to look at the upper lid conjunctiva. Okay, pink, no hemorrhaging, no infection noted. When I look at the lower conjunctiva, it's pink, no infection noted, no hemorrhaging. The eyes, the sclera of the eye is white. There's no jaundice noted. There's no hemorrhaging noted. The iris is a normal color. The pupils are 2 to 3 millimeters in diameter. And the cornea and the lens is clear with no opacities. Okay, so now I also want to palpate your frontal sinuses. Do you feel any tenderness?
No.
When I palpate your maxillary sinuses, do you tell me if you feel any tenderness?
No.
Okay, great. Now I'm going to assess your lacrimal system. Do you feel any tenderness?
No.
Tenderness here?
No.
No drainage noted. When I assess the medial canthus, do you feel any tenderness?
No.
Okay, no drainage noted. When I assess the lateral canthus, do you feel any tenderness?
No.
Okay, no drainage noted there as well. Okay, now I am going to do a direct light test. No, you know what? I'll start with the visual acuity test. Let's do that. All right, so let's go ahead and hold this. Bring your arm out. Cover your left eye and read this line for me.
OLCF.
Okay. Now cover the other eye. Hold the card.
OLCF.
Okay, great. You have 20/50 vision in both eyes. Now I'm going to do a direct light test in the left eye. The right eye. So when I look in the right eye, the pupils constrict, which is a normal finding. Now I'm going to do a consensual light test. I'm going to look in the same right eye. I'm going to look in the right eye. The left eye constricts as well as the right. And now I'm going to do a convergence test. So I want you to follow the pen as it moves inward. Okay, great. Both pupils constrict. Convergence is noted. I'm going to do an accommodations test. I want you to look at the cabinet, please. Now look at my pen and follow the pen inward. Excellent. Convergence is noted. Accommodation is noted. Pupils are equal, round, reactive to light and accommodation. Okay? All right. Now I'm going to test your peripheral vision, which is cranial nerve 2. Tell me when you see my fingers.
I see.
Excellent. Cranial nerve 2 is intact. Now we're going to test cranial nerve 3, 4, and 6, which is the extraocular motor test. Just follow my finger. Don't move your head. All right. Cranial nerve 3, 4, and 6 is intact. Okay. Now we are going to do a fundoscopic test. Okay. So I'm going to turn the light off. I'm going to look in the right eye. Okay. So when I look at her right eye, the red light reflex is present. There's no hemorrhaging noted. The red vessels are intact. There's no black spots. The macula is yellowish in color with a milky sheen. The optic disc is 1 to 2 with sharp edges. There's no blurriness noted. There's no hemorrhaging noted. Okay, So now I'm going to assess your nose. Oh, I'm going to use this. I'm sorry. All right. So I'm going to first palpate your nose. Your nose is symmetrical with your face. Can I palpate your nose? Do you feel any tenderness at all?
No.
Excellent. So I'm going to look inside your nose. When I look inside your nose, the mucosa is pink. There are no polyps, no lacerations. The septum is not deviated. It is midline, and there's no drainage noted. Can you occlude one side of your nose with your hand? Breathe in and out for me. And the other side. Excellent. Both nares are patent. Okay. Now I want to assess your mouth. When I look at your mouth, the lips are pink. They're moist. There are no lacerations or scarring noted. I'm going to look inside your mouth. When I look inside your mouth, say ah. Open up for me. All right. Perfect. So there's no exudate noted. The tonsils, are +2 in size. The mucosa is pink. The hard and soft palate is noted. There are no missing teeth. There's no decay noted. There's no hair on the tongue noted. Can you lift up your tongue? Okay, the frenulum is intact. Excellent. Okay. Now I'm going to assess your ears. So when I look at your ears, they're both symmetrical. Okay, I'm going to just palpate your ears if you don't mind. All right. Do you feel any pain when I palpate? Excellent. Okay. Now I'm going to look inside your ears. Look inside the left ear. I'm going to pull the auricle up and back. Okay. The tympanic membrane is pearly gray in color. There's only mild serum noted. There's no perforations, and the cone of light is noted at 7 p.m. If I did it on the other side, the cone of light will be noted at 4 p.m. Okay, now I'm going to do a whisper test. I'm actually going to stand on the left side. I'm going to ask you to cover your left ear, and I'm just going to whisper. You tell me if you can hear me.
1, 2, 3.
Excellent. Okay, and I will do the same on the right ear. There's no hearing loss. Now I'm gonna do the Rhines test. I'm sorry, the Rhines test. So I'm going to bang my tuning fork. Do you feel the vibration?
Yes.
Okay. So no hearing loss noted on either side. Now I'm gonna bang my tuning fork again. And I'm going to put it on the mastoid bone. Do you feel the vibration?
Yes.
Okay, let me know when it stops.
Okay.
All right. Now, do you hear the vibration?
Yes.
All right. And did it stop?
Yes.
Okay, great. All right. So here, air conduction is greater than bone conduction, proving that she does not have conductive hearing loss. Okay? All right. So now we're going to do, I'm going to assess your neck. So I'm going to check the carotid arteries first, one at a time. It's +2 on each side. I'm going to just palpate the neck. The neck doesn't have any lacerations or scarring or lesions. Do you feel any tenderness when I palpate?
No.
Excellent. Okay. No mass is noted. I'm going to check the trachea. It's not deviated. It's midline. I'm going to check the thyroid gland. The thyroid gland, if you could please swallow, I'm sorry. Okay. All right. No mass is noted. Did you feel any tenderness upon palpation?
No.
Excellent. Okay. Now I am going to assess your lymph nodes. Okay. So you just tell me if you have any tenderness whatsoever. Okay. This is the preocular lymph node. Any tenderness?
No.
Postocular lymph node?
No.
All right. Occipital lymph node?
No.
Excellent. Okay. Tonsillar lymph node?
No.
Submandibular lymph node?
No.
Submental lymph node?
No.
Posterior lymph node?
No.
Posterior cervical. Supracervical lymph nodes?
No.
Clavicular lymph nodes?
No.
Subclavicular lymph nodes?
No.
Deep cervical lymph nodes?
No.
Okay, excellent. Now I'm just going to take a look at your chest. Okay, do a respiratory assessment. Okay, when I look at your chest, I don't see any lacerations, lesions, or edema. I'm going to look at the posterior chest. When I look at the posterior chest, there's no lacerations noted, no lesions noted. Okay, first I'm going to palpate your chest to see if you have any tenderness at all. Do you have any tenderness?
No.
None?
No.
Okay, excellent. What about posteriorly?
No.
No? Okay, excellent. Now I'm going to percuss the chest. Okay. Going to go underneath this here. Thank you. Thank you. Okay, now I'm going to auscultate the lungs. I'm just going to ask you to breathe in and out for me. Oh, upon palpation, upon percussion, vibration felt, no dumbness felt in all lung fields. In and out, please. In and out, in and out, in and out, in and out, in and out. Okay, we'll do the back now. Posterior, just in and out, 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 in and out. Excellent. All lung sounds are clear. No abnormalities noted. Now, I'm going to actually do an egophony test now. So I'm going to ask that you please say E each time I put the stethoscope on your back. Say E.
E, 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 E.
Okay. Lung sounds are soft and muffled. I'm going to ask that you say 1, 2, 3.
1, 2, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Okay, I'm going to do a diaphragmatic test. Exhale. Okay, and again. AP diameter is 1 to 2 with no barrel test, and that concludes my assessment.